Hello, Diana. Is it Diann?
Yes,
Yeah,
just
okay.
Diann.
So, yeah, Diann, sorry. So you're going to run down on remedial massage. Yeah.
Remedial massage.
All right, okie dokie.
Uh, Now, remedial massage is a technique used on all parts of the body, working with trigger points and referred pain. We can specialise in certain areas, mostly neck, head and shoulders is stress-related problems, where you might have computer, RSI or whiplash from car accidents, where we can actually work the trigger points and release tension that's caught up in muscles. Where blood stasis is locked, fibres of muscles are shocked where the trigger points are, which locks blood into the fibres, and the trigger points we use release those blood stasis areas, allowing circulation and blood to re-enter those fibres to create a flow of energy and causing balance and harmony to come to the body's muscles. The technique used is relatively related to sports injuries, intensive accidents in sports, compound injuries where you've got corks in the fibres of the muscles. If there's any problems with post-surgery problems where you've got shortened muscles from cuts from open surgery operations, it's very good with that. There's also minor injuries that can be worked with remedial sports massage. We do also in the remedial, there is aromatherapy techniques that we can help people with. There's also mobilizing, which is a form of movement of the muscles in gentle form to create a less painful technique on the trigger points. And then we have also another technique called deep tissue. It's more sports related, where we get deeper into the muscle and load the muscle with pressure, with thumbs, elbows, whole palm pressure down onto the muscle itself, causing like an impact technique on it, and then wriggling it vastly and quickly to relate a different sensation to the muscle itself, allowing new energy to come in and new circulation of blood. That's about it. The other techniques I use is the shiatsu diploma is absolutely fantastic for similar problems. It goes deeper into the body using the meridians, the external meridians. We diagnose first and come to a understanding of where the patient's imbalances are through the diagnosis. We then move on those imbalanced meridians, working with the organs that are imbalanced, energy-wise imbalanced, and through that we create a healing process that usually takes around 3 days, 2 days in some cases, and anyone that appears to have good circulation and has a lot of energy moving in their body that has a minor injury, shiatsu is very rapid, within 1 hour to 2 hours results. The reason being it's so quick, I feel, is that the diet is possibly well balanced, a lot of water intake that client would be having, and also the meridians are receptive because they're used to being open and flowing with energy and blood. This brings a healthy, balanced human being emotionally, physically and mentally. When the human being is balanced, then they have a more balanced health pattern of living and a more successful lifestyle with longevity and long life, which is all that we're trying to achieve. In my opinion, I believe the shiatsu is outstanding in itself. It speaks without talking, as far as I'm concerned. I've had over 3.5 years of shiatsu and acupuncture together, weekly, every week, for the last 3.5 years. Yeah. And I'm balanced as best I can, and it just overwhelms me with the amount of energy I own. I'm totally hooked on it, if you want to hear it in a common sense. There's nothing I've found that is far greater than this. Personally, my 2 children are bounding on this subject too. They keep asking me, "Mum, do this, do this." So I believe if children are asking for it, they're so naive and they understand what they want. I believe their energies are craving for this to be balanced. Yes, I really don't know what else to say.
That's okay. Thank you so much for your time, Diann.
Okay.
Okay.